opioid epidemic touching every American community. Fentanyl is 50 times stronger than heroin, and synthetic opioids are the cause of more than 150 American deaths every single day. The epidemic is worsening for our children and teenagers. Earlier this month, one high school in Virginia recorded 8 opioid overdoses in just 3 weeks. Now, fortunately, all of those students survived. But according to the CDC, monthly overdose deaths among adolescents increased. You see that number on the left, by 109% between 2019 and 2021. We do want to bring in Dr. Rahul Gupta now, the White House Director of National Drug Control Policy. Dr. Gupta, it's good to see you again. Thank you for joining us.
Thank you for having me, Natasha.
Tell us about your new push right now. You and Education Secretary Miguel Cardona actually sent a letter to every state education agency urging schools to carry overdose reversal drug Naloxone and to train staff and students on how to use it. In your opinion, is having Naloxone on site as important as a school having something like an AED in the building?
Yes, we believe that at this time when we are seeing so many young people overdose and unfortunately sometimes even fatally overdose, it's critically important that they are aware, like a fire extinguisher, like a defibrillator, that naloxone becomes prevalent. But also the secretary and myself try to remind school administrators that the best thing is to prevent use before it begins. So that prevention part is so critical for young people in school systems. But then again, we can't stop there. We got to make sure that people are able to be aware of it and then use this particular drug, which is naloxone Narcan, which reverses the overdoses from opioids like fentanyl, which is so lethal, as you mentioned.
Yeah, I think a lot of Americans picture something like this happening to teenagers or children at parties or after hours. You think that it'll actually help to have these stocked at schools? Is this something that is happening on campuses?
Absolutely it is. And the unfortunate fact today is while the drug prevalence overall has flattened for young people, but the deaths and overdoses are increasing primarily because oftentimes when the young people get online off these drugs like Xanax or Adderall, they're not aware that actually 6 out of 10 times it has fatal doses of fentanyl in it. So it's oftentimes young people aren't even aware of the pills that they're taking.
Yeah.
Could be
And we know that some communities have pushed for naloxone vending machines in accessible areas, and they've encountered controversy many times. There are critics who say naloxone only enables addicts. It provides a safety net for dangerous behavior. What is your response to that?
Well, the facts don't bear that out. What facts tell us is that it is not enabling. It actually saves the life. It allows us to connect people to treatment because oftentimes people are using drugs because they have, a substance use disorder, which is an addiction. It's a disease of the brain. And it allows us to get people to help save lives. And I think we can all agree that saving a life is precious, and we should all be on the side of saving lives. Certainly the president is on the side of making sure we're saving as many American lives and getting them the help they need.
Of course, this is a recommendation. Is the White House also pushing for funding for schools to purchase naloxone, or how does that work?
Yes, the good news here is that we have unprecedented levels of funding available now to both expand treatment and access, but also have naloxone available in communities, in local schools. So there's a historic level of funding that is going out to states now to be able to purchase naloxone and make sure that whether it's schools, it's malls, it's businesses, that we make this available. The worst thing that can happen is you're going to end up saving a life of a stranger, somebody you don't know. But oftentimes it might be someone that you do know. And we found that in 2 out of 3 kids, young people who died, bystanders were nearby, but naloxone was not.
Okay. Dr. Rahul Gupta, I appreciate your time. Thank you so much for coming on the show. Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.